So good evening, all the participants. Today is the fifth session in the EpiBio series, and we are going to talk about ecological studies. First of all, why ecological studies? Because this is a neglected topic as far as the epidemiological study designs are considered. And in our PG activity, consistently, we have noticed that there are gaps in our understanding about this study design. And secondly, it is also seen that many postgraduate students attempt to take up these studies because there are many advantages, as we will see as we proceed further, but there are small errors which can easily be avoided. Hence this topic. Now, let's first understand how the ecological studies are different from the individual level study designs. What do I mean by individual level studies? The typical epidemiological study design algorithm in which we divide studies as intervention studies and observation studies, and all the different types of observation studies are individual level studies because we collect data from individual units. But this is not so with respect to the ecological study design. So can anyone tell me what is it if not the individual studies? How is this different, the ecological studies?
Population is the unit of the study, ma'am.
Very good. So it is actually here it is the individuals who are a group of study, while here it is some groups, right? So we are talking of groups. The study unit, what we say is the study unit is different in ecological studies. So you should remember this. What is the study unit in all of these study designs? It is the individual participants, right? While in ecological studies, it is not individual participants, but it is the groups which we are studying. So our unit of measurement and our unit of analysis is various groups and not various individuals. Now, to throw some more light on this distinction, let us consider our favorite example of smoking and lung cancer. Now, a case control study, as we said, is an individual level study design. So what do we do in a case control study? We enroll individuals, say A, B, C, D, and so on. And we collect data on their outcome status. And then we ask them about their exposure and some other variables. And we begin with patients or individuals who have the disease, some who do not have the disease, and we enroll them and we ask them history of exposure, some having the exposure and some not having the exposure, right? And then we do our analysis for these individuals who have been enrolled in the study. So we have our 2 by 2 table, and then we calculate our odds ratio of exposure, and we say that the odds of the exposure in cases with the outcome is so much more or less compared to those who do not have the exposure. And we also interpret this as the odds of outcome in individuals with exposure compared to without exposure. But in ecological studies, I told you all, our unit of measurement and analysis is groups, right? So I would here, instead of individuals, take some group, for example, countries. So I have now country, not individuals, countries A, B, C, and D. And what do I collect data on? I collect data on, again, outcome, that is lung cancer and smoking. But this time it is not presence or absence of the outcome or the smoking. I will have to collect some other data for outcome and smoking, which is at the group level. So can anyone guess what it would be for the outcome lung cancer? Say these are countries, USA, India, UK, Australia. What kind of data you would collect for lung cancer at group level? Anybody can volunteer. Here it was yes, no, whether outcome is present, not present, and exposure is present, not present. That is, lung cancer is present, not present, history of smoking present, not present. Would we be able to do that for a country?
No,
Obviously.
ma'am.
So what would be our measurement? So we will come to this later on, but please give this a thought. Like, we'll have to collect data on variables, some measurements for lung cancer at country level and also for smoking at the country level. This is a hint I'm giving you all. So if anybody thinks they know the answer, the PG students, they can volunteer.
Ma'am, incidence of the disease in
Right. So
country wise.
1.1 could be incidence of lung cancer. So you will collect data on incidence of lung cancer for all countries. What about smoking, Ajit?
How many the usage of smoking in the countries like
Yes, so the prevalence, right? The
yes.
prevalence of smoking, or say the proportion of the population who smokes, that will be the exposure. So the measurements or the data which you capture is different in ecological study than a individual level study. This is what we are trying to understand with this example. So the unit of study in the example which we saw for lung cancer and smoking was countries, right? We would want to collect data on outcome and exposure for countries, but there can be other groups you could take into consideration. For example, states. You can do an ecological study for states, say in India, or the districts in a particular state, or even say hospitals or lab or your operation theaters, because I don't know whether the uh, faculty and students from, I had some enrollments from pathology, from anesthesia, from pulmonary medicine. So you can have your unit, which is not just countries, states, districts, but also it could be hospitals, it could be labs, it could be operation theaters, etc. So anywhere where your unit of study is not an individual, but a group entitles to be a ecological study. Are you all with me?
Yes, ma'am.
Thank you. So this is one step in understanding what is a unit of study. Now, what kind of research questions are the ones you will take up for ecological study? Now, wherever you want to investigate the differences between groups or you want to study the group level effects, both mean the same. What does this mean? That you have different groups and these different groups have different exposure levels. And you are interested to see how the outcomes vary with respect to the different exposure levels in the groups. So when you want to do this, that is, you want to see how these differences tally with these differences, which is also to say what is the effect of these exposures on the outcome at the group level. So when you are interested in things happening at the group level, that is the time when you will consider ecological studies. You will get more clarity as we move forward. Now, for examples which will clarify the kind of research questions to be taken up, supposing we are interested in studying whether the hardness of drinking water is associated with mortality due to coronary heart disease. Do you think this is an apt topic for ecological study? Anyone can volunteer. Will you?
Yes,
What
ma'am.
I'm trying, yeah. Yeah, what I'm trying to say is, will you conduct a individual level study or an ecological study for this question?
Ecological study only.
Yeah, why?
Ma'am, because the people who are drinking the water will be the group of people who are drinking will be.
Yeah, correct.
Yes.
See what happens, no? If you consider individuals in a community, it is more likely that all the individuals in the community are drinking the same kind of water with respect to hardness, right? So there is no point in doing a study within the community. If there are communities which have different level of hardness, you would be interested in looking at the hardness in the communities and then looking at the mortality rates, whether that varies with the level of hardness which varies in these communities. So this question is appropriate not for an individual level study but ecological study. Similarly, alcohol prohibition and intimate partner violence. Again, you could consider the states in India as your unit of study. Here, you could consider cities, or you could consider the districts wherever this data is available for hardness of water and for the mortality due to coronary heart disease. Now, supposing for the states you have data about alcohol prohibition and intimate partner violence, this is also a research question which is appropriate for ecological study. So you can have states which have laws, regulations for which prohibit alcohol consumption, or you could grade it according to the strictness with which this prohibition is implemented. So this will be your exposure, and the prevalence of intimate partner violence will be your outcome. So in each of these cases, what you do is you have a series of groups, either countries, states, cities. You have to collect data on the exposure, that is, say, the level of hardness here, and the data on CHD mortality for example number 1. For example number 2, you have to get data on whether the different states have laws, regulations about alcohol prohibition, and parallel to it, what is the prevalence of partner violence in different states. That is what makes it an individual study. Here, we are not going to individuals and asking them about their alcohol consumption and not asking the partners about their experience of any violence. We are not asking individuals or assessing what is the hardness of drinking water for the individual, and not looking at the outcome of the individual in terms of mortality or the cause of mortality, but we are looking at groups of people and collecting data at the group level. This is what makes the ecological study different. So when you want to do an ecological study, what are the steps? First, you decide on what will be your unit of study. That is, what are the groups you are interested in. So usually from your observation, from your discussions with experts, from your reading of the literature, you should come up with some interesting research questions, and then depending upon where you are confident, where you can get some reliable data, you will have to also consider that aspect to decide on your groups. So whether you are interested to study different countries or different states in Maharashtra, in India, or different districts in Maharashtra, you can take up any scenario and do an ecological study. Next point you need to consider is the data. So you have to now decide what is your outcome variable and what is your exposure variable. Both have to be at the group level for the ecological study. This is important, that both have to be at the group level. And what do you have to decide when you are designing your study? You have to define what is your outcome and what is your exposure. And you have to decide also what is the source from which you are going to get the data for the outcome and the exposure at the group level. So both things you have to write in your methodology. And then, of course, once you extract the data for all the groups you have taken into consideration, you go in for the analysis and then for the appropriate inference, which we will discuss as we move forward. So what are the group level measures? We have already actually, for both these questions, we have already seen what could be the group level measures, but let us get some more clarity. For this first question of whether hardness of water is associated with CHD mortality in, say, the cities in India. What do you think will be the, I'll stick with the cities ABCD. What do you think will be the exposure data and the outcome data which you can collect? So for hardness of drinking water, what do you think would be the group level measure for city A, B, C, D?
Ma'am,
One,
the
yes,
like
please.
the community level water, whatever they're using, like the water treatment, jahan se they are supplying the water. So
Yes,
for each city, we can collect the source of water, वहाँ का जो hardness है.
correct. So for all cities, might be there will be hard, the readings will be there, many readings for many days. So you may take the mean hardness of water for a fixed duration of time, right, Renal?
Yes, ma'am. Yes,
So
ma'am.
mean hardness for a specific period of time, you will collect for all cities. And then you would also try and collect data about the cause specific mortality rate for coronary heart disease. So this is the kind of data you will collect for each. So usually in ecological studies, you do not collect any primary data. You have to find out sources from which you can collect data. So might be you may have to request the water treatment plants or any agency which is doing the tests and has maintained the records. Or if the Department of Water Supply has this data on the website or in their annual reports, and this data also from some community level survey or studies which have been done, you can extract data. And so these are all usually secondary data which you collect. Now, supposing we are interested in alcohol prohibition and intimate partner violence, I have already told you for alcohol prohibition, the same thing, that is for your uh, states. Now we are saying states A, B, C, D. We want exposure. We want to collect data on exposure and outcome. On exposure, we wanting to know whether the state has any law which prohibits alcohol consumption, yes or no. Or might be another option could be how strict they are with their regulation. So you can grade it in some fashion if you want. So there are different ways you can collect data on exposure. And intimate partner violence again will be the prevalence of intimate. Anyone knows any source from where you can get this data? Prevalence of intimate partner violence at state level?
Ma'am,
From
NFHS.
police station or from hospital records.
Yes, that could be done, but the
NFHS.
NFHS gives data about intimate partner violence. So you can just take data from the report and you can try and see whether you can get any reliable data about alcohol, status of alcohol prohibition. And during the same period, this somewhere have to be linked. That again I'll come back as we move ahead. So what again I'll tell you about the sources of the data, so it will be more clear. But I'm just trying to tell you all what are the variables and what kinds of data you need to extract. So now this is very interesting that okay, we have to collect data at the group level. So what are the different types of group exposures or the measures or measurements? So one is this summary or aggregate measures. What does this mean? This means that you actually, the data has been collected at the individual level, but you are summarizing the data for the group level. Can you think of any such examples? For example, if you want to find out whether the income, the average, like the average, you will have to take the average income of a village and say some outcome like tuberculosis. So you will say, you will look at prevalence of tuberculosis here. Each individual has been asked whether they have tuberculosis or not, and then you are getting a summary measure. You are asking the total family income for each a person, and you are you may calculate the mean or the median income of the village, right? So What happens? The data is collected at individual level, but for the group, you are summarizing data. That is known as a summary or an aggregate measure. We will be talking about each of these measures in the coming slides, but just to get a sense of how they are different from each other. Then you have the environmental measures. Environmental measures means any physical characteristic of the environment in which people are living, working, traveling. All those are environmental measures. So what would be the environmental measures like air pollution indices? So the air quality indices or the rainfall. So all the people in the group experience this more or less in a similar fashion, or the altitude of a particular region, right? So these are environmental measures. And the last one is a global or an integral measure. What does this mean? This means that this is a characteristic of the group. So there is nothing similar you can calculate or you can collect data for at the individual level. An example would be a law. So a state has passed a law prohibiting alcohol consumption. It is a law for the whole state. It is not just for an individual. Another example, which will be, say, the population density or the dependency ratio. These are characteristic of the group. You cannot measure this for the individual. Such measures are known as global measures or integral measures. So when you write your methodology, you should reflect and you should classify your exposures and try and understand, are your exposures summary measures, are they environmental measures, or are they integral measures which are special characteristics of the group as a whole and do not have anything to measure at the individual level.
Ma'am, so the temperature, like for example, global warming, it will come under environmental measure or global measure?
It will come under environmental measure because your meteorological data does give you temperature. So the temperature, rainfall, humidity varies, isn't it, from region to region. So it will be an environmental measure.
Thank you, ma'am.
Yeah. Now, a little bit more detail of these measures. So these three measures are usually for exposures. So the aggregate, summary, or composite measure is a measure, as I told you all, collected at the individual level, and then you summarize it. So if you are collecting data as a binary, yes, no, or any other binary, you will calculate proportion of individuals who have the exposure. If it is quantitative data, you can summarize that data as mean, median with the standard deviation and the interquartile range. So for each group, you have to calculate or you have to extract data in this fashion, the values, these values. Now the aggregate variables you can collect, it can be for exposure and usually it is also for the outcome. So the rates, the prevalence incidence rates which we considered for lung cancer, those are aggregate because data is collected from each individual and then summarized. I hope all of you all agree with me that when you are looking at blood pressure and you want to find out group blood pressure, you will take the mean, and when you want to calculate the rate of disease, that is for the outcome, that is also a composite measure where the data is actually collected at individual level and then summarized. The limitation of this aggregate measure is that, especially for mean, median, for quantitative data, is that you are summarizing it as one value, but there will be variation within the population which not be captured. So you have to always remember this. Now, as I'm telling you the limitations, remember that all this will come in your discussion section as a limitation if you are using these measurements. All these questions which you see in the red are for us to discuss. So can we discuss ways in which you will attempt to estimate group level poverty? Supposing you are studying, you are doing a study in which poverty is the exposure and it is the villages for which you have to collect data on the poverty, and you have different villages. So what do you think are the already I have given you some hints earlier. How do you think you will collect, what kind of data you can collect to categorize the villages in different levels of poverty?
I'm like BPL card holder in that
Yes.
village.
So one is below poverty line. So whether the how many families, or how many the proportion of families in a village which are below the poverty line. That can be one way of categorizing the different villages for exposures. Or the mean family income can be another way of categorizing the families for the exposure level. So what I'm trying to say here is that you can have different ways of collecting exposure and outcome level data at the group level. So you have to decide which is the best way and move ahead. So how do you summarize? How do you categorize is also up to you. The second variable which we were considering was environmental variables. So I told you these are characteristic of the environment in which people are living. Now, some of these variables will affect everyone, so you are safe there because there is no variation from person to person within the group. So when we consider, say, altitude or latitude, everyone is going to be there, so there is no variation. But for some environmental measures, we may take a summary measure, not a summary measure, but a measure for that region. But still there could be variation among members. So you are assuming that ultraviolet radiation, you get measures for a particular locality, but not everyone in that group is going to experience or be exposed to the same level of radiation, because this will vary depending upon the time people are spending outside or the use of sunscreen, right? But all this we do not consider usually. So this will come in your limitation when you're using your group level variables. So you will use this environmental measure, but it could either be that everyone is experiencing it the same way, or that can be variability. So usually environmental measures are exposure measures, but if you have anything like any aspect of climate change, or might be weather, then even environmental variables could come up as outcomes. So if you think innovatively, that can happen. So if you are looking at, for example, rainfall or humidity, and you want to see whether this is associated with fungal disease. So if you have any data about the incidence of fungal disease, then you can look at the changes in the rainfall or humidity from the meteorological data, and you can try and do a study where you look at the association at the group level. Because a region, you can have the same region, a particular region, and you can see how the rainfall or the humidity is varying, and what is happening, whether it's going parallel or not with the incidence of the fungal disease, is how it is related to change in the rainfall or humidity. Or you can take different regions, you can take the mean rainfall, humidity, and look at the incidence of fungal diseases in these different groups. So these are environmental measures, your rainfall, humidity. The next one is the global or the integral measure, which is the characteristic of the group. There is nothing you can measure equivalent to this at the individual level. So laws and regulations, I told you. One example is prohibition of alcohol consumption. Another could be single-use plastic bans. So this is for the group, this is not for the individual. Population density, dependency ratio. So all these characteristics do not exist for individuals, but for groups. So usually you do not measure this for outcomes. These are again exposure level measures. So these three things, what we say just now discussed, was summary environmental measures, and the global measures were for exposure. For outcome measures, usually what you collect data is on the summary measures. And the usual measures are incidence, mortality, prevalence. So of some outcome, you want to collect data or extract data on these measures. So usually, because many of these, especially mortality, age and sex, are big confounders, you have to standardize the outcomes for age and sex. So if you use standardized mortality rates, that is the best case scenario when your outcome is mortality. Also, when you are using prevalence data, basic epidemiology, never forget that there is a big limitation with prevalence data. So you are thinking you are measuring risk with prevalence data, but there is a limitation. What is the limitation? for different groups, you are taking outcomes in terms not of incidence but prevalence. So what do you think is the limitation of taking prevalence as the outcome measurement? Actually, the next line says it all. Just have to explain what it says. Whenever you study prevalence instead of incidence, what happens? Prevalence is affected by both incidence as well as survival, right? The
It
duration
leads
of,
to
yes, please.
nice one. It leads to survival bias, ma'am. That but I'm not sure how.
See, what happens if there is high prevalence? What are the reasons a village can have high prevalence of the disease? One is that there is
There's
high incidence.
incidence and there is duration. Yes, ma'am.
Yes,
High
so the
duration as well.
survival is more, the duration of disease is more. That can also lead to high prevalence, right?
Yes, ma'am.
So
Yes, ma'am.
when you are looking at, so this is another limitation which you should mention in your discussion when you are looking at prevalence data. That is okay.
Okay.
We are looking at prevalence, which is telling us about the burden of disease, but not about risk of disease, because it tells the story of both the risk as well as the survival. But usually,
Okay.
when you are looking at the outcome summary measure, you have these three options, and many studies do report prevalence of an outcome as the group level outcome measure. But one has to then consider this limitation. I hope you all are with me. Joyce? So if you have any questions, please remember that you can raise your hands or you can type your questions in the chat box, or you can write down your questions and ask them at the end of the session. Joyce, do
Yes,
we have any question in the chat box?
no, ma'am. Till now, we don't have any.
Okay, thank you. So this was about group level data. So the group level measures for exposure and outcome, what are the options we have? Then the next thing you should write in your method section is what are the sources of the group level data. So what do you think could be the sources? From where are you going to get these different kinds of data? So many examples we saw till now. So where are we going to get the data about incidence, mortality, about environmental measures? So a characteristic feature is that usually for all ecological studies, it is secondary data. So you have to search for sources which are reliable and valid. You don't go out and collect data. This is a huge advantage also, but also it poses a big challenge. So what are the sources? One is it's the routine data which is collected and reported from secondary sources. For environmental data, you have environmental monitoring units. So much of this data is available in the public domain. Then you have large scale surveys like your NFHS survey or your LASI survey. So they also, there you can extract data for the group level. Or you have different departments who publish their annual reports or who provide all the data on their websites in the public domain. So you can go and collect data for your unit of study from these websites or these reports. And many a times it is okay to collect data on proxy measures. What does this mean? Actually, you are interested, for example, in collecting data on cigarette consumption or alcohol consumption. So you want to find out what is the average consumption, but you know that individual level data will not be available or will not be authentic possibly. Then you take proxy measures, like instead of consumption you look at the sale of that product. That is also acceptable, but again you should mention it as a limitation in your study that you are looking at proxy measures of something, which again is going to pose some kind of limitation. You are saying that this is a good reflection of what I actually want to measure. That is known as a proxy measure. Here you will have to tell reasons. That is, you feel that the data which you have with regards to consumption is either not available or is not reliable, or it is going to be variable too much, and you feel that instead of that the sale of cigarettes is more acceptable and authentic. So you'll have to give a rationale for using a proxy measure. Now I'm going to take you all to some research questions. So the research questions for ecological studies. Now we have to read this carefully because rest of the presentation, we are going to discuss these research questions, at least the first three. So the first research question, can somebody read this out slowly? Sweta, can you read this out for me, please?
I read, ma'am.
Yes, please, sir.
What are the effect of means of transportation to work on the prevalence of overweight and obesity at the US state level?
Thank you, sir. Thank you. So students, can you tell me what is the unit of study here? If the faculty is participating, I am sure the students are willing to participate.
US states,
Yes. So the
states in the
unit of
US, yeah.
study is are the states in United States. Okay, the states. What is the exposure?
Means of transportation.
Yes, it is the means of transportation to work, and its association with prevalence of overweight in the state, overweight and obesity. This is an ecological study where the unit of study is this group, the states. You have this exposure and you have an outcome. Can somebody please volunteer? Student volunteers, please, for the second research question. Just reading it.
What is the relationship between policy indicators, including the stringency index score and the severity of the first wave of the COVID-19 pandemic?
Yes. So what happened? I'll tell you all from where this data is coming, but these policy indicators were considered for different countries. So countries were passing different policies for controlling the COVID-19 pandemic. So these different policy indicators were the exposure for this study. The severity of the first wave of COVID-19 pandemic was the outcome, and the unit of study were the different countries. So this is also a ecological study. The third question is, what are the health effects of changes in macroeconomic indicators? Now this unemployment, inflation, and GDP per capita, these are all macroeconomic measures. So what are the health effects of these macroeconomic indicators on population health? Now this is in terms of mortality metrics, different mortality indicators across countries in Latin America. So this is your unit of study, countries. All these indicators are your exposure, the economic indicators, and mortality is the outcome indicator. We will not look at this last question. I have just included this because the three did not have any environmental measure. Now, quickly, if we can tell about what are the different types of measures here. So, because we are going to come to measure, I think we'll just postpone it there. But just agree that all of these are ecological studies. These are not individual level studies. So as we move ahead, because see the intention of this session is not for you all to be able to write an answer in the theory exam, but for you all to take up topics and do an ecological study and move ahead and design an ecological study. So as we move ahead, you also think about some topics which may come to your mind, which based on your experience, on your discussions, on your readings, you feel is interesting, and try and also ask yourselves what could be the possible measures, what could be your units of studies and measures for exposure outcome for those units. We can discuss this later on. Now I'll just check if those from any other department are with me. If they are not, I will move ahead, because this is just because I want everyone to know that when you don't have an individual as your unit of study, so I don't see anyone actually, so I'll go ahead. You can have, as I told you, labs, operation theaters, anything which is not individual is correct for your ecological study. So I'll just move ahead now. So in the method section, you have to write about exposure outcome. What do you write? You write the definition about the exposure outcome, the criteria, if you have any specific criteria, if you have for any categories in exposure outcome, and the sources from where you are getting the data. So this is what we'll be discussing next. So the three questions which we read out. So let us try and think what could be exposure and outcome, right? So one question was health effect of the macroeconomic indicators on mortality. Just focus on the unemployment. Now the exposure is unemployment. So what do you think? And the units are the countries in Latin America. So for unemployment, what do you think will be the measure for countries? For individual, you will ask unemployed, employed, yes, no. But for countries, you won't ask that question. So what is the data you feel you will extract for unemployment for countries? Right? You will, for each country, you will want to find the proportion of the labor force who is unemployed. The proportion who are eligible for employment are unemployed. So the employment rate, the prevalence of unemployment in the countries, that will be your exposure. Everyone is with me here?
Yes, ma'am.
Okay, thank you. What do you think will be the mortality matrix for the countries? See, what is this trying to study? That if there is more unemployment in a country, are the mortality rates more or less? How is the employment rate associated with mortality in countries? Right? So for mortality might be crude mortality or crude death rate, or might be the infant mortality rate, which could one would say it's a more sensitive indicator, or the neonatal mortality rate, or the sex specific mortality rate. You could have different, because they are talking of mortality metrics. So there could be different ways you want to study mortality. And what you want to study is, see, look at the title, effects of economic crisis on population health outcomes in Latin America, right? So economic crisis is measured in these terms. One of them is in terms of unemployment, and the outcome, the health outcome, they are measuring in terms of mortality. And all of this has to be done for countries in Latin America. So for each country, find out what is the employment percentage, find out what is the, for example, say the infant mortality rate. And you would want to see, for countries with high unemployment, are the infant mortality rate significantly more than those who have low unemployment. This is what this study is all about. So this is what they have measured. So all these are countries in Latin America. They have taken all these measures. Let's focus on the unemployment. So unemployment in 2010, percentage of labor force who are unemployed. So you can see the variation. The least, which is the least one you can see? If anybody can help me, the least unemployment is in which country?
Cuba.
Cuba.
Cuba
Cuba
2.5.
Yes,
2.5.
Cuba, it is 2.5. And the maximum unemployment is in which country?
Haiti is 21.
21.
21 in
Haiti.
Haiti.
21 in
Haiti.
Haiti, right? Yes, so there is variation in the unemployment rate across these different countries. So this is a measure of the exposure. Similarly, they have measured inflation, they have measured GDP per capita. Instead of GDP per capita means They can compare across countries. And usually the population, or if you have to use weights, for example, in this study, they would have used the total population as the weights, because that will also matter. And the civil registration coverage, that they have mentioned, because that will give us some hint about how reliable the outcome statistics or the outcome data will be, right? So the outcome data they have measured in terms of female adult mortality, male adult mortality, neonatal mortality, post-neonatal mortality, and 1 to 5 mortality. Okay. Again, in the previous thing, I told you what are you to write in the method section. One is what is your unit of study, what is your exposure variable at the group level, define it. So we have defined unemployment as percentage of total labor force, and then look at the what is written in the footnote. So you have to write the source from which you are getting data. So they have got it from World Bank, the website, right? So when somebody reads this, they know that, okay, this is authentic data. Similarly, for outcomes, you have all these outcomes. So as I told you, I'll define. Now keep this in mind, because you have to define this, because how you interpret your results depends upon how you define your exposure and outcome variable. So remember, what is the exposure? It is percentage of total labor force who are unemployed. And what is the outcome variable? Let us look at only two outcome or one outcome variable, say the male adult mortality, right? So how have they defined the male adult mortality? Number of deaths per 1,000 male adults. This is how they define. They also say for what period they have collected the data, and then they are also saying they are collecting this data from the IHME, which is this, again, the footnote, Institute of the Health Metrics and Evaluation. So you have to mention the source from which you are extracting the data, because the reader knows how authentic your data is. So for each of these outcomes, they have named the outcome, defined, and mentioned the source. The next question, which we read out, was about transportation, means of transportation, specifically to work, and prevalence of overweight and obesity at US state level. So now what do you think will be the exposure? You want to measure the means of
Means of
transportation to work?
transportation to the
Yes,
work.
please.
Yes,
Yes, please.
yes, ma'am. Yes, the means of transportation to the work will be the exposure, ma'am.
Yes, but what exactly can we
Uh,
measure? Supposing there are three means of transportation we are interested in, right? Like somebody is using their own vehicle and driving, say they are driving to the workplace, somebody is walking to the workplace, or somebody is using, say, public transportation, somebody is walking or cycling to the workplace, and somebody is using, say, public transport. If this is what supposing is there, then what will you measure? But what will you measure? If it would have been an individual, you would have asked them, what do you do? Drive, walk, cycle, use public transport. But what happens at the state level? What will you measure? Again, you want to find out the percentage of the population, the working population, who drives to work, who walks or cycles to work, percentage who use public transport. So for each state, you will want to get data on these variables. Agree, Siva?
yes, ma'am, I agree. But
Yeah.
how do we get it, ma'am? Yeah.
Yeah, we won't get it, but this study is conducted where? So they will get
In
it.
US, ma'am. Yes, ma'am.
So
Okay, okay,
many developed countries have all sorts of data, but I would
okay.
reassure you all, or assure you all rather, that in India also now, so much of data is available in the public domain. You have to go and search. And I'm sure not this kind of data, but sufficient data for us to do an ecological study. So try and you will come up with interesting research questions, search, and I'm sure you will get the data. Of course, not this level of data, but
Okay.
some interesting questions. What about the outcome? So this outcome is already mentioned here, prevalence, right? So prevalence for each state, you want the prevalence of overweight and obesity.
This we can get in this larger
Yes,
studies like NFHS. Yes.
yes. So in our country also, we can get this data. Next is, again, let us try and see what they have done. So these are the outcome of the dependent variables. So as we said, percentage of adults, there they have to specify what they have taken. So whatever the reports are saying, that they will have to stick to for obesity and overweight. And they will mention the data sources from which they are getting data. Again, authentic data source. Then the exposure or the independent variable. So walk to work, drive to work, and transit work, right? So they are taking public transportation, then they are saying transit to work. And from where are they getting this data? From the state transportation statistics, right? So they have this data. And this is part of the result section where, remember, all of these are numbers. Again, this you have to understand that many a times in ecological studies, your exposure and outcome both are numbers, right? So when you have many numbers, what you end up doing is summarizing it. So these are the descriptive statistics in your result section for your exposure and outcome variable. You summarize it as mean, median, interquartile range, and report. So what is the prevalence of obesity, overweight? What percentage of the working group is walking, is driving, is using public transportation, is given here, right? So there will be percentages for different states. This is the mean of those percentages. The next question was, now this is a bit difficult, relationship between policy indicators and severity of first wave of COVID-19 pandemic. So naturally, for policy indicators, you would want to get data on different policies. So if there are some 10 policies, whether the policy was passed or was being implemented in the country or not, and how strictly it was implemented over a particular, you can score it in some fashion. That is one way of doing this. And the outcome was severity. So you will have to also decide how you are going to measure severity. So one thing which would possibly come to mind is the mortality rate. Mortality, some way, due to COVID-19, you would most probably look at that as severity of COVID-19 pandemic. So for this also, you will have to come up with interesting exposure and outcome variables. So for this study, what did they do? They looked at, the Oxford University had this tracker. This was again a website in which they were giving data for all of these 17 indicators. So there were some containment closure indicators, there were some economic response indicators, health system indicators, and this tracker was giving information for many of the countries on these policy indicators. So all the authors needed to do was extract this data. So they fixed up a date. It was, if I remember correctly, say 20th May. So very early on in the pandemic, this study was conducted. So they are collecting data on mortality, which is the outcome, as well as all these policy level decisions which are taken in different countries from this government response tracker, which was hosted by the Oxford University. So what was the level of strictness? They gave an ordinal score for these indicators. So school closures, workplace or work from home, cancelling public events, or say that what was the testing policy in a particular country, contact tracing, whether they were testing for special groups only, or whether they were opening up testing for the general population. So all of this was given a score, and that resulted in their measurement of the exposure variable, which was policy decisions taken by the country for containment closure, economic response, or in terms of services in the healthcare system. So this was one thing. Outcome was mortality. As I told you, this is a bit of a complicated study, but they have different terms. They are measuring some negative outcomes like severity of pandemic in terms of mortality rate, and some favorable things. So analysis makes it a bit complicated, but let's just focus on mortality. So each one they have defined. We will not go into the details of the definition. The take home message is telling what the outcome measure is, defining it properly. What is the source here? It is from the World Health Organization. So the exposure measurements are coming from the Oxford University hosted website. The outcome measures are from the WHO, which was reporting on the mortality or the deaths which are occurring because of COVID-19 in different countries. So this is what you need to do for your exposure and your outcome. So are you all here with me? If you have any questions, Joyce, any questions?
No, ma'am.
So what we have done is we have tried and to understand what could be the different units of studies, what could be the different exposures, how would you measure them? You would measure them either as a summary measure or as an environmental measure or a global measure. What do you think were these measures which we saw? So just quickly we will go through this. So unemployment, what do you think is a type of exposure measure of the three types? It is the
Individual.
yes. So individual, then aggregate. So it's a summary measure,
Yes,
proportion, right? These are also summary measures. Usually outcomes I told you are summary measures. What about again obesity, overweight? They are summary measures. What about key independent variables here? They are also summary measures because actually individuals have been asked and then they have been aggregated at the state or at the state level. Then what about this? The closures, what do you think these are? School closure, workplace closure, what kind of measures are these?
The global.
Yes, these are global
indicators.
measures,
Global
right?
indicators, yes.
Yes. So these are global measures. They are there for that particular country. They're not separately there for any individual, right? So that you have to again consider. Again, here, these are summary measures. So this actually, a large chunk of the method section is done. Now, the analysis. What do you all think will be done in the analysis? You have exposure, you have outcome, and you have your groups.
Correlation.
Yes, why would you do that? These are numbers,
Both-
right?
Both
So
are numerical. Yes.
your exposure outcome both are usually quantitative data, right? So what Ajit said is right. One is correlation. Anything else you would do? What comes with correlation? Correlation and what comes with correlation usually?
Association.
Sorry?
Regression.
Yes, regression, right? Which regression you will do?
Linear regression.
Yes, because you have quantitative outcome. What kind of regression you do will depend. Now, what I'm telling you is a very basic standard type of analysis. And then if we have the energy left, I'll tell you what other kinds of analysis can also be done for ecological, for ecological studies. Yes. So this is if majority of the studies, you will see this is what is reported, right? But you don't jump to correlation and regression immediately. Once you have collected data for all the study units for exposure outcome, what will you do before going to inferential statistics? This is inferential statistics because you are studying the strength and the direction of the association. You don't go for inferential statistics. What do you do before that?
We start with the descriptives, no?
So descriptive, you have to
statistics.
first describe, right? So what you do first thing to describe is usually your exposure and outcome. Exposure and outcome are quantitative. So you summarize your exposure outcome. I already showed you some of those summary measures. So you summarize your exposure outcome in terms of mean, median, the summary measures for variability, or even graphically you can depict them in the form of your box whiskers plots, right? So you first report what is the distribution of your exposure outcome. Then you describe the association with some graphs. which graph you will use? If you are, you know that now the next thing you are going to do is correlation and regression. Which graph you will draw?
Scatter plots.
Yes. So you will want to draw the scatter plot. The scatter plot is actually the first step, the graphical presentation and the summarizing of your exposure outcome, because it helps you get to know your data better and also to visualize the pattern and to see whether the assumptions for correlation regression are more likely to be met or not. So eyeing or eyeballing the data through graphs is important, right? So analysis usually just telling you all that they are numbers. So when you have group level measures, proportion of houses with no latrine in villages, these are numbers. Per capita cigarette consumption in different states, these are numbers. Median family income of the households in the village, these are numbers. So exposures are numbers. Group level outcomes, the incidence of childhood diarrhea, the mortality rates, these are numbers. So this outcome is a number. This is what you have to remember. But because this is also a number, you can summarize them in a similar fashion and you can then go to the next step of assessing the relationship using a scatter plot. Now we all know scatter plots. I'll not go into it. Where is the outcome variable? Where is the exposure variable in the scatter plot? What does one dot represent in a scatter plot? This all we know. But what the scatter plot helps us do is to assess the overall trend. What happens to the outcome variable as the exposure variable changes, whether as this increases, whether this increases, decreases, or there is no pattern at all. So you have to look at the scatter plot and make a judgment first and then move ahead. The next thing is to quantify the relationship or the association between the exposure outcome. You have already answered this particular question by saying that you are interested in the correlation and you are interested in the regression, that is the linear regression, right? Of course, you have to see that the assumptions for all this are met or not. So what are the different kinds of correlation we know of?
Pearson's correlation,
Yes,
Spearman correlation.
Pearson correlation and
Spearman.
Spearman correlation, right?
Yes, ma'am.
We also know how they differ from each other, right? So when will you use the Pearson correlation?
And the exposure variable is a numerical variable.
Outcome,
Like
outcome,
outcome is numerical in both the things.
yes.
Exposure will be continuous in Pearson and categorical in Spearman.
Yes. So firstly, it has to be a quantitative data, either on a ratio or an interval scale. Here, it can be on the ratio interval scale. Ordinal or ranked data can also be taken up if your outcome is in this on this scale for the Spearman correlation coefficient. Now, this is more strict because the assumptions of normality have to be met here. For both, there is an assumption of independence. So the next slide is this, so I won't go into detail about how the two are different from each other, but you want to find out the correlation between the exposure and the outcome values, right? So this is the first step, and the second step you can go ahead is with regression. So we'll just go through this, right? So what does the correlation coefficient do? The correlation coefficient quantifies the strength and the direction of the relationship. The Pearson correlation tells us about the linear association or the linear relationship, and the Spearman correlation tells us about the monotonic relationship. Now, linear means what? Linear means if the exposure variables, if it changes by a particular unit, 1 unit, the independent or your outcome variable changes by equal units, right? Predictable units, that is linear. What is a monotonic relationship? Monotonic relationship is when the independent or the exposure variable increases. All that you know is that the outcome variable goes in a particular direction. So it can be either a straight line or it can be curvilinear, right? It can increase or it can decrease. If this is not allowed in a monotonic relationship, that is, it increases, decreases, or it decreases, then it increases. Okay, that is not allowed. In monotonic means either straight or in a curvilinear or in any fashion, it as one increases, another goes in the same direction. Here, linear is more strict, right? So there is an increase, but there is a specific increase in the outcome. That is the difference between the two. So this you can do for specific kinds of data. This you will do whenever the assumptions are not met. I will talk about this in the next slide. How is regression different from correlation? Correlation only tells you what is the strength and direction of the association. Regression helps you to predict the outcome. If this exposure changes by 1 unit, I am able to predict how does the outcome change? How much does I am able to quantify and predict how much the outcome will change. Hence, this is different, right? The regression is different from correlation, and this is reported by R for the Pearson, rho or RS for the Spearman, and the beta coefficients for the linear regressions. So this is something you all should know. Now coming to the differences between Pearson and Spearman. So when your data is continuous, it's on the ratio interval scale, you go for a correlation coefficient, which is Pearson's. Assumptions of normality have to be met. You have to test for normality. I'm sure all of you all know how to test for normality. And then you have to also assume that there is a linear relationship. This is by looking at the scatter plot. So look at the scatter plot and see whether there is roughly a straight line relationship. If yes, you go in for the linear, for the Pearson correlation. As I told you, that is ability that for 1 unit change, there is a change by a fixed amount in the outcome. That is a linear relationship. Now, Pearson correlation coefficient is sensitive to outliers. So it means if there are outliers, be careful. The observations have to be independent. Means what? You have different countries, right? And you have the unemployment rates for different countries. Now, the unemployment rate of one country should not influence the unemployment rate of the other country. That is meant by independent observation, right? So all your observations should be independent of each other. And this coefficient is calculated based on the standard deviation and covariance, and it can vary from -1 to +1. The same points about Spearman correlation, it can be done for all of this, of course, but also for ordinal data. It can be done for normal, non-normal data. It's a monotonic relationship. Curves not allowed, otherwise change in the same direction is okay. Now, this is not sensitive to outliers. So if you have outliers, one option is to switch to Spearman correlation coefficient. Another option is to transform the data, right? You can transform the data and handle your outliers. Again, the observation should be independent. And if there are ranks and differences, when Spearman correlation coefficient is calculated, all the numbers are ranked, and these ranks are used in the calculation of the coefficient. Again, this range is from -1 to +1. Of course, I am sure you all know how to interpret these values, so I'll not go there. Just the difference, because you need to decide, and in your method section, you need to tell which correlation coefficient you are calculating and why. Now we come to the results of the studies which we have looked at earlier. So this is about the policy indicators and the COVID-19 pandemic. So we'll just look at one indicator, right? Now this is very confusing. The only thing I want you to understand, if it is green, it is a favorable outcome. If it is red, it is an unfavorable outcome. Okay. So how will you interpret? Now we are looking at interpretation. So this is school closing. These are low income countries. These are high income countries. And this is school closing. So you have the result. So this is the Spearman correlation coefficient. A Spearman correlation, this of course, this marks that P is less than 0.05, the star mark. So how will you interpret this value of this correlation coefficient, if anyone can volunteer?
I would give a try, ma'am, here.
Please do.
Yes, ma'am. School closing, we are taking that particular thing, comparing it with our mortality, ma'am. It's the negative sign says that it's negatively correlated.
Yes,
And the value is zero point 0.6, which is somewhere between zero point 0.4 to zero point 0.7. So it's a moderately negative, moderate correlation.
yes.
And the star says it's significant. So we can say that school closing is negatively correlated with the mortality because of COVID.
Yes, good, Siva. Right, you are absolutely right that in high income countries, school closing there was correlated negatively with the mortality rate, and it was statistically significant. No such association was seen in high income countries. Now, you will also be surprised when you look at the values which are shaded red, because investment in vaccines, emergency investment in healthcare. Now, in this article, the discussion, they have not really mentioned about these findings in detail, but all they say is that this study was done very early on, and before the impact of many of these interventions would have been visible. So that is one explanation they have given. Anyways, our objective here is to understand that one way of reporting the association is using the Spearman rank order correlation, where the ranks are first given and then their correlation is reported. So you look at the direction, whether it's positive, negative, and the values also help us to throw light on the strength. So as Siva said, this is moderate negative correlation between school closing and mortality rate in high income countries. The next slide tells us about the next thing we are interested in the analysis, that is regression, right? So now these are effects of unemployment on mortality metrics. So how would you, this one, how would you interpret this value? This is again, this is a beta coefficient. This is a linear regression. This now is regression. So how would you interpret the values for the male adult mortality? Anyone would volunteer? This is, as I said, this is, I don't know where I am. Okay. So this is linear regression, right? And these are the results for the linear regression. So the independent is the proportion. So what I told you, when you are making your inferences, you should look at the way you have defined your variables. So your exposure variable was percentage unemployed in the countries, in the different countries, right? And your outcome was male adult mortality per 1,000 adult males, right? This is important for your interpretation. I am
When we say
giving you
that
hints actually.
when there is, can I try here?
Try.
Uh, when there is increase in 1 unit of unemployment, we
Hmm.
can say that there is an increase in 1.14 units of male adult mortality.
Yes.
Uh,
So if the unemployment rate increases by 1%, the male adult mortality increases by 1.14% adult, that is adult per 1,000 adult males. And this is statistically significant. And then of course this range is there, right? How will you comment here? What is the null value you would expect in linear regression? Is this significant? Just looking at the confidence interval.
the null value should actually increase.
Sorry, Siva.
But the null value is zero over here.
Yes. So here the null value is 0. Everything is positive. So as expected, this is
Just
statistically
significant.
significant,
Significant.
right?
Yes, ma'am.
So this is what you should be able to infer. So in countries, again, remember, now can I say, okay, that interpretation will come later on. This, remember that this is what you will say that for countries, right? In a country, for countries, if the unemployment rate increases by 1%, in that country, the male adult mortality rate will increase by 1.14 for every 1,000 adult males. So unemployment rate was found to be significantly associated with all of these mortality metrics. This is what was the main take-home message for this particular study. Now we come to the next one, that is transportation to work and prevalence of overweight and obesity. Luckily for you all, this is again linear regression, and you should be able to interpret it. But one warning I will give you is, look at this word, 1 year lag, and then try and interpret the outcome. I told you that always think of the outcome when you're writing your results. So the outcome is prevalence of overweight and obesity. Exposure. What is the exposure? It was the percentage of individuals using three different methods of transportation to work. Now you can interpret, I think. Anybody would give a try? Forget the lag. If this lag was not there, anybody would attempt? Just this. What does this tell us? This, or say this? It does tell us that as the percentage of people in a country who drive to work increases, the coefficient is positive. It does tell us that the obesity
Positively.
prevalence increases, overweight prevalence increases, and it is statistically significant, right?
Yes, ma'am.
Yes, ma'am.
The lag tells us is that when the percentage of people who drive increases in a country by 1%, the obesity prevalence increases by 0.15% the next year.
After 1
Okay,
year.
this is the 1 year lag. So for each thing, what they have done, they say that whatever is happening will not have an influence on the prevalence of obesity that same year. We want to look how it influences the prevalence of obesity the next year. Can somebody now try and interpret this? These are the standard errors, but we just want to interpret the beta coefficient. We'll go for walk to work. Let's interpret this. Anybody is interested in this?
States where the people are going by walk are negatively correlated
This is
with
not correlation, Ajit. This is
the
regression.
negatively.
So again, if the percentage of people who walk to work increases by 1% this year, right? This year or in 1 year, the next year, the prevalence of obesity in that particular country, or I think they have taken the state,
Yes,
the US state, the prevalence
decrease.
will go down by 0.3%, and this is statistically significant. This is what it means, right?
Yes, ma'am.
So again, remember, if you look at the things can get complicated, they have used linear regression, okay, but it's panel fixed, and again, you have to consult a statistician when you're doing ecological studies because it can get complex. So because they have used 10-year data for whatever number of studies, so many regions are there and many time periods are there, they have used panel fixed effects regression. So panel is what? There are multiple regions, multiple groups, and there are multiple time periods. So it's like a longitudinal follow-up of multiple groups. So they have used panel data and panel regression. So the inferences, right? So inferences is what we have already seen actually. So the policy indicators, we have seen one particular inference, but this is the inference for investment in vaccines. You can see this is strong to moderate correlation. This is correlation with the severity of pandemic. So this had a positive correlation. This is telling you the change in the outcome per unit change in the exposure. This we have already discussed. 1% increase in the people who are driving to work in the states of US, the obesity increases by 0.15%. Similarly, unemployment, adult mortality also, we have interpreted the beta coefficient, 1% increase in unemployment, the male adult mortality increases by 1.14 per 1,000 adult male. So inferences, capacity to do correct inferences, all these inferences are to be made at the group level. Now, this is something which you all again have heard of no ecological fallacy. What does this mean? If you are doing ecological studies, you have, this is group level incidence, right? So group level effects, you cannot make inferences for individual level, at individual level, right? Just 1 minute, I'll just come back. Because my friend is calling me actually. Yeah, I'm sorry. So I have a crow who visits me at this time every day. So just excuse me. So we have this ecological fallacy, which is when you are doing an ecological study, the inferences have to be made at the group level. You cannot make the inferences at the individual level. What does this mean? If you consider the study of transportation to work, right, and obesity, what was our inference? Now, can I say here that individuals who drive to work have a higher risk of obesity? Can I make that inference for this study?
No, ma'am.
Yes,
No,
so that will be a ecological fallacy. That is, group level effects which you are observing in ecological studies, you cannot infer that those effects are true at the individual level. But again, here I must warn you, this goes either way. So if you find a association at the group level, you can go and test whether it holds true at the individual level or not. But you cannot infer that it holds true, right? It may or may not hold true both ways, because ecological studies many a times are kinds of studies which help us in hypothesis generation. So one thing we can do is, a hypothesis is generated, go ahead and test it at the individual level. But if you make such kind of inferences in your discussion section, then you are committing a ecological fallacy. That is what you have to remember, right? And when you write your discussions, don't say that there is ecological fallacy in all ecological studies only when this inference is drawn. So you will say that you are interpreting it in this particular fashion and preventing ecological fallacy. So remember that when you are writing an ecological study, every time you need not write that there is a risk of ecological fallacy. There is a risk only if you make that inference. That is something which you should remember. So now it is 6:30, and these are other topics which we can take up in the coming, say, half an hour, or we can do it some other time. So